Good morning everybody and welcome to the Practice Managers Networking event. My name is Campbell. I'm a Program Consultant working at Networking Health Victoria, and I'm here to talk to you today about the Health Benefits of Safe Work program and the implementation of the Certificate of Capacity into general practice. Before we start off today, as with any presentation, there's actually some learning objectives that we just want you to be aware of. So the first of all is to be aware of the key messages of the Health Benefits of Safe Work program, and also to develop an understanding of the rationale behind the revised Certificate of Capacity. We understand that there's a new Certificate of Capacity, and it's really good to actually have some idea as to why that's been introduced. And also to be aware of what your practice can do to ensure an ease of transition in using the Certificate of Capacity within your general practice setting. So with regards to the Health Benefits of Safe Work program, NHV, or Networking Health Victoria, is working in association with the Health and Disability Strategy Group, or HDSG, which is a collaboration between TAC and WorkSafe to deliver the Health Benefits of Safe Work program to general practice and also to assist with the implementation of the Certificate of Capacity. So a little bit about the Health Benefits of Safe Work program. The Health Benefits of Safe Work program was actually work that was done by the Australasian Faculty of Occupation and Environmental Medicine in 2001, and they actually released a position statement on realising the health benefits of work. The RACGP is actually a signatory on a consensus statement, which will actually go through some of the points now with regards to that. So it's building upon that work that was actually done in 2011. So the role of the GPs in realising the health benefits of safe work is that work is an important part of rehabilitation. Work is actually seen as a therapeutic intervention, so it can be just as important as writing somebody a script for medication. And typically, waiting for recovery actually delays the return to work. Staying away from work may actually lead to poorer health due to social isolation and the increased chance of developing other associated diseases. An employer-supported early return to work actually aids the recovery of the patient. So there were evidence-based messages. We're actually going to see how that evidence-based message can actually be translated into practical ways that GPs can actually assist in returning their patients to work. So recommended a gradual increase in activity. Set a timeline for return to work. Set some goals with the patient as well. Talk to the employer, preferably while the patient is with you, especially how return to work duties can actually assist the patient. Collaboratively identify obstacles and solutions. Now that can be with the patient and also with the employer. And also being clear about what healthcare plan can and can't achieve. And finally, identifying possible sources of support. So there's just some key messages with regards to the health benefits of safe work. What I'd also like to focus on today is actually the Certificate of Capacity. So we'll just go through that now with you. So I don't know if some of you are aware, but actually July 1st, 2014, a new Certificate of Capacity was actually introduced into general practice. But as of March 2015, this combined Certificate of Capacity will actually replace all previous versions. So this is a combined Transport Accident Commission and WorkSafe certificate. Previously, they were two separate certificates. The purpose of which is to improve information exchange and encourage a positive focus on what an injured worker can do. It's about supporting the conversation between GPs and their patients about returning to safe and sustainable work. And it's actually looking at reducing the number of forms certifiers use through alignment across TAC and WorkSafe. And as you know, we're always interested in what we can do to reduce the paperwork. Align the work with the workflow of a consultation, including integration into medical software. So your GPs are actually able to work through the flow of actually assessing, advising, setting expectations with the patients, certifying capacity, and then setting a review date with the patient. And the certificate certainly aligns itself to that. Okay, here on this particular shot, we can actually see that previously there was an initial TAC form and then subsequent TAC form that could be utilised, and also a WorkSafe form that could be utilised. As we can see now, there's actually a certificate of capacity that actually does incorporate Transport Accident Commission and WorkSafe, so they're for all those patients. So there's just looking at the certificate again. It is a double-sided A4 certificate, much, much easier to utilise than those previous certificates. So where to look at accessing the combined certificate of capacity, it's actually available on both the TAC or WorkSafe websites as a smart form or a Word document. So there are the actual websites that you can go to. If you're still a paper-based practice, you can still order the printed forms via the print media group, but you must be aware that you need to incorporate the specific code, which is FOR-844, and specify that it is a certificate of capacity. And you can fax those details through to the number there shown on the screen. Also, it's available in your medical software as a supplied template in the clinical software. So this combined certificate of capacity is available in the software packages. These include Best Practice, Medical Director, Genie, MedTech 32, Stat Health Systems, Practice, SmartSoft, ZMed, Medinet and Profile. And as you can see on the screen there, it actually tells you what type of template is actually and the naming convention within your software package. So why do we actually need to have a combined certificate of capacity, or why do we need to actually have a certificate of capacity? It's actually to enable payment of income benefits to all TAC and injured workers. It actually is to determine the capacity for work, and it's about what the patient can do as opposed to what they can't do. And it's also used as a communication tool with key people supporting your patient in returning to work. The certificate of work capacity must be on medical grounds only, must be related to the compensable injury, and should reflect the patient's capacity of what they can do as opposed to what they can't do, and also the availability for suitable employment. It's not up to the GP to find the worker suitable employment, it's actually up to the employer to do so based upon the certificate that the GP has written for them. So an appropriate certificate is actually seen as an enabling tool that it can actually trigger support and services for the injured patient. What then happens to the certificate? Okay, so the original certificate is actually taken by the patient and a copy is kept by the certifier. For WorkSafe, the original certificate should be taken to the employer, who in turn should send it to the WorkSafe agent. For TAC, the certificate should actually be sent by the TAC client or GP practice to TAC directly. Just to note that fax certificates are accepted if they're received in full. So the legal requirements for WorkSafe and TAC patients. Injured workers, WorkSafe must actively participate in returning to suitable work or pre-injury employment when they have the capacity to do so, and when it's actually offered. So this includes participation in occupational rehab if this service is actually provided. Some compensable payments can actually be ceased or reduced if a TAC client does not accept a reasonable offer of suitable employment or a reasonable offer of rehab or vocational rehabilitation services. So it's something just to keep in mind. Okay, so we're just wanting to know, is your general practice ready for the certificate of capacity? So Networking Health Victoria have actually just developed an interactive checklist designed to assist with the implementation of the combined certificate of capacity within your practice. So hopefully you actually have one there with you today. So the thing to note with this practice readiness checklist, that it's actually an interactive, and it can actually be downloaded on your desktop to ensure that your practice is ready. So the key areas that are highlighted in the checklist are actually the clinical software location of the certificate. So we've spoken a little bit about that earlier. We actually remind people to actually remove all old templates from your software and also hard copies that you may have. There's always a sneaking suspicion that there's an old pad left somewhere within the practice, so we ask that you actually remove those as well. There's actually points for the GPs on actually how to complete the certificate. And there's also CPD. We highlight the CPD accredited activities for GPs. That they can actually be involved in if they're wanting to find out a little bit more around the health benefits of safe work or the role of the GP in return to work. And also there's information on actually where to find more information from both TAC and WorkSafe. There's links that take you straight to these key areas that I've highlighted, so it's really important to make the most of this, and this is available through your Medicare local. Okay, just to go through some of the TAC and WorkSafe scheme information, which could be of benefit. Some of this information you may already know because you may have currently a lot of TAC or WorkSafe clients that you've dealt with in the past, but for those that are unaware, it's just important to go through. So please just take the time to go through this, and any questions at the end we can actually follow up with then. So just a reminder of what TAC actually does. Okay, its role is to promote road safety in Victoria. It pay for treatment and benefits for people that are injured in transport accidents. Funding used by the TAC comes from payments made by Victorian motorists when they register their vehicles each year for Vic roads. So the TAC receives approximately 17,000 claims per year. So what WorkSafe's role is to enforce the occupational health and safety laws to prevent workplace injuries and illness. It actually looks at providing workplace injury insurance and actually manages the Victorian Work Cover Injury Insurance Scheme through authorised WorkSafe agents. And I'll go through a little bit later as to who the WorkSafe agents are. What WorkSafe authorised agents manage is actually the employer's work cover injury insurance policies and also injured workers' compensation claims. There are approximately 30,000 work cover claims per year, so that's a huge amount, hence the need for having quite a number of authorised agents to manage these. So some of you may be aware of these agents. So we have Allianz, Exchanging, CGU, Gallagher Bassett and QBE. So each of you may have dealt with each of these agents or all of them. Okay. Just keeping in mind, both of these schemes are actually no-fault schemes. Legislation guides the TAC and WorkSafe in the types of benefits it can pay and any conditions that apply. So the Transport Accident Commission is actually governed by the Transport Accident Act in 1986, and WorkSafe, there's a couple of legislative acts that actually cover this, which is the Accident Compensation Act in 1985, Accident Compensation Act of 1993, and also the Workplace Injury and Rehabilitation Compensation Act of 2013. The TAC and WorkSafe policies and practices are actually guided by this legislation. Okay, so a little bit about the provision and payment for services. TAC and WorkSafe can pay the reasonable costs of medical services required by their clients. The costs are paid in line with MBS item numbers unless other specified in TAC or WorkSafe policies. So if you're wanting to find out more about that, you actually go to these links and you'll actually find out about the reimbursement rates. So payment for medical invoices, as I said before, some of you may already be aware of these guidelines, but it's just important to reinforce them. So invoices can be sent directly by mail to the WorkSafe agent managing the claim or directly to TAC for transport accident claims. For the invoice to actually be processed, the patient must have an accepted claim and their excess may be met. And we'll talk a little bit more later about the excess. Invoices must include the following details. So the patient's claim number, their details, their billing details, and the provider and service details. And this is an ideal opportunity to ensure that your patient's records are actually up to date and correct. So if you're wanting more information, if you just click onto the link and it talks about invoicing guidelines for medical practitioners. So working with TAC and VWA, so we spoke a little bit before about the excess, and it's actually initial payment payable by either the patient in the event of a TAC claim or the employer with regards to a WorkSafe claim, and it's for the reasonable costs of medical services. So as you can see there, the excess that's actually paid and how it's actually paid too. So the TAC Connect area is actually responsible for the processing of accounts. So it's the TAC payment officer which actually processes the account, and the claim staff are responsible for making decisions and determining entitlements. So if you're actually wanting to have any questions or queries, they are the people that you actually need to speak to. So there's some details there on how you can actually find out more about payments that are to be paid. So the TAC details are actually there, or to contact your patient's claims manager individually. With regards to WorkSafe, the agent's accounts processing team actually manages the payment of the invoices. The case manager is responsible for making decisions and determining entitlements. So for any inquiries relating to account payments, you contact the agent customer service or your patient's care manager at the particular managing agent or the WorkSafe advisory service. Okay, so as a provider, you can actually choose between daily, weekly, fortnightly or monthly payment cycles, and you have the choice between EFT or cheque payment methods. I think EFT is actually seen as the preferred option. It depends on how your particular practice likes to work. Remittance notice methods of communication that the TAC and WorkSafe use to advise providers of the status of their accounts. Okay, so with regards to communication between GPs, employers and the TAC and WorkSafe, it is lawful for TAC and WorkSafe and their agents to collect information relevant to a TAC or WorkSafe claim from healthcare professionals. So it's actually lawful for healthcare professionals to disclose an individual's information to the TAC and WorkSafe where the individual has consented through completing the applicable claim form, and the health information provided is relevant to the claim. So it has to be about the compensable injury, nothing more than that. Patient consent, GP communication with the employer. So the GP should actually establish their patient's consent in accordance with their professional obligations. This is really important. The employers actually must also obtain a consent to contact the treating healthcare professionals, so they need to be speaking to their employees as well. And the discussion is solely for the purpose of assisting the patient's rehabilitation and return to work, dependent upon the relevant claim. If you've got individual or specific scenarios, you need to obtain independent legal advice with regards to guidance related to that. So treating health practitioners reports, I know a lot of you are aware of these, and they can be requested by Transport Accident Commission or WorkSafe agent to actually gain information relating to the patient's work related to transport injury or illness. So what does a treating health practitioner report do, or what does it provide? Provides information about determining eligibility for entitlements. It looks at reviewing the ongoing medical and health needs of the patient, and looks at the management of rehabilitation and return to work needs. So just to note there, the Accident Compensation Conciliation Service, medical panel or other legal representatives can also request a treating health practitioner report. The report needs to only address the requested questions and cannot be a clinical copy, I beg your pardon, of the clinical notes or a previously submitted report. So once again, the treating health practitioner report is actually to assist with that timely decision on a patient's treatment, and services report should be returned to the TAC within 10 working days of receiving a request, or the relevant WorkSafe agent within 10 days of receiving the request. To ensure the timely processing of payment, the invoice should include the item code and amount agreed by the TAC or WorkSafe agent, and if not, please contact these relevant bodies to discuss further with them. So for more information, TAC, the website and contact phone number are there, and the same with WorkSafe. Networking Health Victoria have a range of resources available for use within general practice, and this is our contact number and details. Once again, thank you very much for your participation today. Any questions or queries, feel free to ask them now. Thank you.